Burn injuries are inherently traumatic, often leaving patients physically and emotionally vulnerable. When a patient presents with burns, especially under sensitive circumstances, establishing a safe and trusting environment becomes paramount. This initial interaction sets the tone for the entire patient journey, emphasizing compassion and respect throughout. Start by greeting the patient warmly, introducing yourself clearly and stating your role. A simple, "Hello, my name is Dr. Gupta, I'm here to help you with your burns today," can be reassuring. Maintain a calm and empathetic demeanor, using a gentle tone of voice and maintaining appropriate eye contact, remember. The patient may be in pain, scared, or hesitant to share their experience. Be patient, offering a comforting presence and acknowledging their discomfort. Simple gestures like offering water or adjusting their positioning for comfort can communicate care and concern. Building trust takes time. Avoid rushing the conversation and allow for pauses and moments of silence. Your initial goal is to establish a safe space where the patient feels heard, respected, and understood, paving the way for open communication and effective care. Once the patient feels a sense of safety, gently guide the conversation towards understanding the incident and their current condition. Begin by asking open-ended questions about the event that led to the burns, such as, "Can you tell me what happened?" or "How did you get injured?" Listen actively, paying close attention to both verbal and non-verbal cues. Be patient and allow the patient to share their story at their own pace, without interruption or judgment. Encourage them to elaborate on details that seem important to them, even if they seem tangential at first. As the patient recounts their experience, be attentive to any inconsistencies or vague explanations surrounding the incident, especially if the burns seem inconsistent with their story. This might indicate potential abuse or a need for further investigation. However, refrain from making any judgments or accusations at this stage. The priority is to gather information and build trust. A comprehensive assessment of a burn patient extends beyond the visible physical injuries. It's crucial to recognize that burns can deeply impact a patient's mental and emotional well-being, especially when associated with trauma or potential abuse. While gathering the patient's medical history, including any pre-existing conditions and current medications, inquire about their support system. Ask about family, friends, or anyone they can rely on during this time. This information is vital in understanding their social context and identifying potential sources of support. Transition smoothly from the medical history to a sensitive exploration of their emotional state. Use open-ended questions like, "How are you feeling emotionally?" Or, "Are you feeling safe at home?" Observe their body language and listen for any signs of fear, anxiety, or withdrawal, which might indicate a need for psychological support. Section 4. Empowering the patient, safety and support. When dealing with sensitive burn cases, especially those hinting at potential abuse, patient safety and empowerment are paramount. It's crucial to remember that patients have the right to make decisions about their own bodies and lives, even if those decisions seem difficult or unwise. If the patient's story raises concerns about their safety, broach the subject delicately. Avoid direct accusations and instead express concern for their well-being. You can say something like, "I'm concerned about your safety and want to make sure you have a safe place to go if needed." Explain the available support services, including shelters, hotlines, counseling, and legal aid. Provide them with contact information, even if they don't seem ready to accept help at that moment. Empower them with the knowledge that they have options and are not alone. Section 5. Respecting autonomy, navigating difficult decisions. Respecting patient autonomy is crucial, particularly in sensitive situations where disclosing abuse or seeking help can be incredibly difficult. Patients may hesitate due to fear, shame, or cultural factors. As a medical professional, your role is to provide information, support, and resources while respecting their right to make their own choices. Remember, forcing a patient to report abuse against their will can be counterproductive and might deter them from seeking help in the future. Instead, focus on building trust and empowering them with the information they need to make informed decisions. Clearly explain the potential consequences of their decision, both for their health and safety. However, reassure them that you're there to support them, regardless of their choice. Offer to connect them with social workers or relevant support groups that can provide guidance and advocacy. Section 6. A path forward, continuing care and resources. As the consultation concludes, ensure a clear and concise summary of the management plan for their burns, including any necessary follow-up appointments, wound care instructions, and pain management strategies. Provide written instructions whenever possible, ensuring they understand the information. Before concluding the consultation, reiterate the availability of support services and provide contact information for relevant organizations. Emphasize that they can reach out at any time, even after they've left the hospital. Creating a safe, supportive, and respectful environment is paramount when treating a patient with burns, especially under sensitive circumstances. By prioritizing the patient's emotional well-being alongside their physical recovery, medical professionals can play a crucial role in their healing journey and empower them to make informed decisions about their health and safety.